Hello friends, welcome back to 𝗙𝗂𝗊𝗚 YouTube channel. Today you are attending 100 most repeated and most important question answer session based on Staff Nurse Exams 2025, and this is the part 1 of this series. So let's challenge your quality of learning. Let's see what will be your score from this part 1. What is the transparent layer in front of the eye called? Your options are retina, cornea, sclera, or iris. The correct answer is B, that is cornea. The cornea is the clear, dome-shaped surface that covers the front of the eye and plays a significant role in focusing light onto the retina. Question number 2. Which of the following is the normal range for systolic blood pressure in an adult? Your options are 80 to 100 mmHg, 100 to 120 mmHg, 120 to 140 mmHg, or 140 to 160 mmHg. The correct answer is C, that is 120 to 140 mmHg. The normal systolic blood pressure for adults is typically between 120 to 140 mmHg. Higher values may suggest hypertension. Question number 3. What is the function of the retina? Your options are to focus light, to detect light and convert it into neural signals, to regulate light entry, or to support the eye shape. The correct answer is B, that is to detect light and convert it into neural signals. The retina contains photoreceptor cells, rods and cones that convert light into electrical signals sent to the brain. Question number 4. Which type of blood vessel is responsible for the exchange of gases and nutrients? Your options are artery, vein, capillary, or aorta. The correct answer is C, that is capillary. Capillaries have thin walls that allow the exchange of oxygen, carbon dioxide, and other nutrients between blood and tissues. Question number 5. The presence of which antigen determines if the blood is Rh positive? Your options are A antigen, B antigen, Rh antigen, or no antigen. The correct answer is C, that is Rh antigen. If the Rh antigen, which is also known as the D antigen, is present on red blood cells, that blood type is Rh positive. Question number 6. A slow pulse rate is referred to as? Your options are hypotension, hypertension, tachycardia, or bradycardia. The correct answer is D, that is bradycardia. Bradycardia is defined as a slower than normal heart rate, typically less than 60 beats per minute in adults. Question number 7 for you. What type of joint is found in the wrist? Your options are hinge, ball and socket, pivot, or candyloid. The correct answer is D, that is candyloid. The wrist joint or radiocarpal joint is a candyloid joint. This type allows movement in two planes: flexion, extension, and abduction and adduction. Question number 8. A person with blood group AB can receive blood from which of the following? The options are A, B, AB and O, A and B only, AB only, or O only. The correct answer is A, that is A, B, AB and O blood types. AB individuals are universal recipients because they do not have anti-A or anti-B antibodies, allowing them to accept blood from any group. Question number 9. The 𝗍𝗪𝗵𝗄 pulse is located. The options are in the neck, on the top of the foot, in the groin, or at the wrist. The correct answer is B, that is on the top of the foot. The 𝗍𝗪𝗵𝗄 pulse is found on the top of the foot, near the base of the toes, and it is used to assess blood flow to the feet. Question number 10. Which blood vessel connects arteries to veins? The options are capillary, arteriole, venule, or aorta. The correct answer is A, that is capillary. Capillaries connect the arterial and venous system, allowing nutrient and gas exchange between blood and tissues. Question number 11. What type of connective tissue stores energy and insulates the body? The options are cartilage, adipose tissue, bone, or blood. Correct answer is B, that is adipose tissue. Adipose tissue stores fat, serving as a reserve energy source, and it also provides insulation to maintain body temperature. Question number 12. What is the preferred treatment for asymptomatic placenta previa at 30 weeks? Your options are immediate delivery, corticosteroids and observation, bed rest and monitoring, or blood transfusion. The correct answer is C, that is bed rest and monitoring. Asymptomatic cases are managed conservatively with bed rest and monitoring to prolong the pregnancy. Question number 13. Which muscle is known as the Taylor's muscle? Your options are sartorius, rectus femoris, biceps femoris, or adductor longus. The correct answer is A, that is sartorius. The sartorius, the longest muscle in the body, assists in flexion, abduction, and lateral rotation of the hip. Question number 14. What is the main function of the fibula? Your options are weight bearing, muscle attachment, shock absorption, or joint stabilization. The correct answer is B, that is muscle attachment. The fibula primarily serves as a site for muscle attachment and provides lateral stability to the ankle. Question number 15. Which blood group has anti-A and anti-B antibodies in the plasma? Your options are A, B, AB, or O. The correct answer is D, that is O. Blood type O has both anti-A and anti-B antibodies in the plasma, meaning it will attack blood types A, B and AB. Question number 15. What should be the first action if a patient shows symptoms of hypothermia? Your options are: increase the ambient temperature, give hot fluids, apply ice packs, or use cold compresses. The correct answer is A, that is increase the ambient temperature. For hypothermia, it is crucial to warm the patient gradually by increasing the ambient temperature and using warm blankets. Question number 16. Which vessel supplies the heart with oxygenated blood? Your options are: aorta, coronary artery, pulmonary artery, or inferior vena cava. The correct answer is B, that is coronary artery. The coronary artery supplies the heart muscle with oxygen-rich blood, ensuring it functions properly. Question number 17. Which blood vessels have the slowest blood flow? Your options are: arteries, capillaries, veins, or venules. The correct answer is B, that is capillaries. Blood flow is slowest in capillaries to allow sufficient time for the exchange of gases, nutrients, and waste. Question number 18. Which factor does not usually decrease pulse rate? Your options are: deep sleep, hypothermia, stress, or physical inactivity. Correct answer is C, that is stress. Stress typically increases pulse rate as body responds to the fight or flight mechanism, unlike sleep and relaxation, which slow it down. Question number 19. A bounding pulse is usually associated with. The options are: dehydration, anxiety, low blood pressure, or high blood pressure. The correct answer is D, that is high blood pressure. A bounding pulse feels strong and full and is commonly seen in individuals with high blood pressure or during episodes of excitement or exercise. Question number 20. Which of the following might lead to an increase in pulse rate? The options are: cold weather, hypoxia, meditation, or fasting. The correct answer is B, that is hypoxia. Hypoxia, a lack of oxygen in the tissues, can cause the body to compensate by increasing the heart rate to deliver more oxygen to vital organs. Question number 21. Which tissue type contains goblet cells? Options are: connective tissue, muscular tissue, epithelial tissue, or nervous tissue. The correct answer is C, that is epithelial tissue. Goblet cells are specialized epithelial cells that produce mucus found in the lining of the respiratory and digestive tracts. Question number 22. Which connective tissue lacks blood supply, leading to slow healing? Options are: bone, adipose tissue, cartilage, or blood. The correct answer is C, that is cartilage. Cartilage is vascular, meaning it lacks a direct blood supply, so nutrients diffuse slowly, leading to delayed in healing process. Question number 23. What might a pulse deficit indicate? The options are normal cardiac function, blood pressure fluctuation, heart arrhythmia, or adequate oxygen levels. The correct answer is C, that is heart arrhythmia. A pulse deficit occurs when the heart's contractions are not strong enough to produce a pulse at the peripheral sites, often indicating arrhythmia. Question number 24. Which pulse site is used for blood pressure measurements? The options are radial, femoral, brachial, or popliteal. The correct answer is C, that is brachial. The brachial pulse located in the arm is commonly used when measuring blood pressure with a cuff. Question number 25. Which component of blood is responsible for carrying oxygen? Your options are white blood cells, platelets, plasma, or red blood cells. The correct answer is D, that is red blood cells. Red blood cells contain hemoglobin, which binds to oxygen and transport it from the lungs to the tissues and organs of the body. Question number 26. Which heart chamber is directly affected by reduced blood flow in CAD? The options are left atrium, right atrium, left ventricle, or right ventricle. The correct answer is C, that is left ventricle. The left ventricle pumps oxygenated blood to the body, and it is typically the most affected chamber during a heart attack due to CAD. Question number 27. Which blood vessels transport oxygenated blood from the lungs to the heart? Your options are pulmonary arteries, pulmonary veins, aorta, or coronary arteries. The correct answer is B, that is pulmonary veins. Pulmonary veins carry oxygenated blood from the lungs to the left atrium of the heart. Question number 28. What is the function of the corpus luteum? Your options are produce estrogen only, produce progesterone and estrogen, release the egg, or stimulate ovulation. The correct answer is B, that is to produce progesterone and estrogen. The corpus luteum secretes progesterone and some estrogen to maintain the uterine lining during the early stages of pregnancy. Question number 29. What is the function of mast cell in connective tissue? Your options are transport oxygen, produce collagen, release histamine, or provide structural support. The correct answer is C, that is release histamine. Mast cells release histamine during allergic and inflammatory responses, helping to mediate immune reaction. Question number 29. What is the primary function of the fallopian tubes? Your options are to produce hormones, to transport eggs from ovary to uterus, to nourish the embryo, or to prevent fertilization. The correct answer is B, that is to transport eggs from ovary to uterus. The fallopian tubes carry the ovulated egg from the ovary toward the uterus and are the site of fertilization. Question number 30. What is the medical term for painful menstruation? Your options are amenorrhea, dysmenorrhea, menorrhagia or oligomenorrhea? The correct answer is B, that is dysmenorrhea. Dysmenorrhea refers to painful cramps during menstruation caused by uterine contractions. Question number 31. Which type of epithelial tissue is best for protection against abrasion? Your options are simple squamous, stratified squamous, cuboidal epithelium, or transitional epithelium. The correct answer is B, that is stratified squamous. Stratified squamous epithelium has multiple layers of cells, providing excellent protection in high friction areas like skin and esophagus. Question number 32. Which nerve supplies the deltoid muscle? Your options are axillary nerve, musculocutaneous nerve, median nerve, or radial nerve. The correct answer is A, that is axillary nerve. The axillary nerve innervates the deltoid muscle, enabling shoulder abduction. Question number 33. Which blood vessel carries deoxygenated blood from the heart to the lungs? Your options are aorta, pulmonary vein, pulmonary artery, or superior vena cava. The correct answer is C, that is pulmonary artery. The pulmonary artery carries deoxygenated blood from the right ventricle of the heart to the lungs for oxygenation. Question number 34. What is the primary function of the Montgomery glands in the breast during pregnancy? Your options are producing colostrum, regulating maternal hormones, facilitating fetal movement, or lubricating the nipples. The correct answer is D, that is lubricating the nipple. Montgomery glands secretes oils that lubricate the nipples and aid in breastfeeding. Question number 35. Which stage of labor is associated with the delivery of the baby's head and shoulder? The options are first stage, second stage, third stage, or fourth stage. The correct answer is B, that is second stage. The second stage of labor involves the delivery of the baby's head and shoulders. Question number 36. Which joint is a hinge joint in the upper limb? Your options are shoulder joint, elbow joint, wrist joint, or acromyoclavicular joint. The correct answer is B, that is elbow joint. The elbow joint is a hinge joint, allowing flexion and extension of the forearm. Question number 37. Which hormone stimulates milk ejection during the breastfeeding? Your options are estrogen, progesterone, oxytocin, or prolactin. The correct answer is C, that is oxytocin. Oxytocin is responsible for the milk ejection reflex during breastfeeding. Question number 38. Which blood vessels carry deoxygenated blood from the body to the lungs? Your options are pulmonary arteries, pulmonary veins, aorta, or inferior vena cava. The correct answer is A, that is pulmonary arteries. Pulmonary arteries transport deoxygenated blood from the right side of the heart to the lungs for oxygenation. Question number 39. During exercise, what happens to the respiratory rate and tidal volume? Your options are decrease in both rate and volume, increase in rate and decrease in volume, increase in both rate and volume, or decrease in rate and increase in volume? The correct answer is C, that is increase in both rate and volume. Exercise demands increased oxygen intake, leading to higher respiratory rate and tidal volume. Question number 40. What does the term COPD stand for in respiratory medicine? Your options are chronic obstructive pulmonary disease, centralized oxygen processing disorder, cardiopulmonary optimization and diagnosis, or continuous oxygenation and pulmonary detox. The correct answer is A, that is chronic obstructive pulmonary disease. COPD is a chronic lung disease that obstructs airflow and causes breathing related problems. Question number 41. In genetics, what is the full form of DNA? The options are 𝗲𝗅RNA, dynamic nucleotide assembly, dual nucleic acid, or diagonal nucleotide amalgam. The correct answer is 𝗲𝗅RNA. DNA is the hereditary. DNA is the hereditary material present in humans and other organisms. Question number 42. What does the abbreviation IBS stand for in gastrointestinal disorders? Your options are irritable bowel syndrome, inflammatory bowel syndrome, intestinal bacterial suppression, or infection and bowel stagnation. The correct answer is irritable bowel syndrome. IBS is a common disorder affecting the large intestine and causing symptoms like abdominal pain and irregular bowel habits. Question number 43. Which lung has 3 lobes, superior, middle, and inferior? The options are right lung, left lung, both lungs, or none of the above. The correct answer is A, that is right lung. The right lung has 3 lobes while the left lung has only 2 lobes. Question number 44. What is the role of the epiglottis in the respiratory system? The options are gas exchange, filtration, protecting the airway during swallowing, or producing mucus. The correct answer is C, that is protecting the airway during swallowing. The epiglottis covers the trachea during swallowing to prevent food and liquids from entering the airway. Question number 45. Which nerve innervates the flexor muscles of the forearm? Your options are radial nerve, ulnar nerve, median nerve, or axillary nerve. The correct answer is C, that is median nerve. The median nerve innervates most of the flexor muscles of the forearm, except for the flexor carpi ulnaris and part of the flexor digitorum profundus. Question number 46. Which blood component is responsible for maintaining blood pH? The options are erythrocytes, leukocytes, platelets, or plasma. And the correct answer is A, that is erythrocytes. Erythrocytes contribute to pH regulation by transporting carbon dioxide, a key factor in maintaining blood acidity. Question number 45. What is the primary role of thrombocytes in the blood clotting process? The options are release of clotting factors, formation of a plug at the injury site, phagocytosis or pathogens, or antibody production. The correct answer is B, that is formation of a plug at the injury site. Thrombocytes means platelets adhere to the site of injury, forming a temporary plug that initiates the blood clotting cascade. Question number 46. In the ABO blood type system, which blood type has anti-B antibodies? The options are B positive, O negative, A negative or AB positive? And the correct answer is C, that is A negative. A negative individuals have anti-B antibodies and can produce anti-RH antibodies if exposed to the RH positive blood. Question number 47. What is the main function of stratified cuboidal epithelium? The options are secretion, protection, absorption, or movement. The correct answer is B, that is protection. Stratified cuboidal epithelium is found in the ducts of glands and provides protection for underlying tissues. Question number 48. Which muscle aids in forced expiration by pulling the ribs downward and inward? The options are diaphragm, external intercostals, internal intercostals, or abdominal muscles. The correct answer is C, that is internal intercostals. Internal intercostal muscles aid in forced expiration by pulling the ribs downward and inward. Question number 48. Which structure is the primary stabilizer of the elbow? Your options are ulnar collateral ligament, annular ligament, radial collateral ligament, or biceps brachii. The correct answer is A, that is ulnar collateral ligament. The ulnar collateral ligament stabilizes the medial side of the elbow joint. Question number 49. What type of muscle tissue is non-striated and involuntary? Your options are skeletal muscle, smooth muscle, cardiac muscle, or voluntary muscle. The correct answer is B, that is smooth muscle. Smooth muscle lacks striations and is controlled involuntarily, found in walls of hollow organs like the stomach. Question number 49. What is the function of the flexor digitorum profundus? Your options are flexes the wrist, flexes the distal phalanges of the fingers, extends the fingers, or abducts the fingers. The correct answer is B, that is flexes the distal phalanges of the fingers. The flexor digitorum profundus flexes the distal interphalangeal joints of the fingers. Question number 50. Which condition often coexists with placenta previa? Your options are gestational diabetes, placenta accreta, oligohydramnios, or fetal anemia. The correct answer is B, that is placenta accreta. The placenta accreta, where the placenta attaches too deeply, often occurs with placenta previa. Time is to comment your score out of 50 questions. And friends, thanks for joining us on this exciting journey. If you enjoyed the quiz and learned something new, then give us a thumbs up and let us know in the comment section. And don't forget to subscribe and hit that notification bell so you never miss out on our upcoming exploration of fascinating topics in the medical field. Until the next time, stay curious, stay healthy. See you.